Welcome, everybody, to the Know Your Meds webinar series. This series is focused on the topics that you told us you most wanted to learn about. Today's topic is a very important one for many of us. It is feeling the pressure, understand your blood pressure numbers and what they mean. My name is Susan Rosenthal, and I'm the Senior Vice President of Marketing at Know Your Meds. Our speaker today is Nimit Jindal. Nimit is a licensed pharmacist that provides patient-centered care focused on chronic disease states and medication management. He earned his Doctor of Pharmacy from Rutgers University and completed residency at the UNC Eshelman School of Pharmacy. Nimit collaborates with all healthcare stakeholders to improve overall healthcare and also patient outcomes. We're so happy to have him here with us. Now to start. We will be muting all of you listeners during this presentation. At the end of the webinar, Nimit will answer your personal questions. So to submit them anytime during the webinar, just press the Q&A at the bottom of the Zoom screen. And know that your personal information will remain confidential. Now, over to you, Nimit.
Thanks so much, Susan. And good evening, everybody. Hello. I am so excited and thrilled that all of you are joining this evening to talk about a really exciting topic. In fact, high blood pressure and talking about these numbers are honestly one of my favorite parts of being a pharmacist, particularly because the information is so relevant, it's so actionable, and it's something that people see every day. I don't think that you can walk down to your local pharmacy without seeing a blood pressure cuff in the store. I remember growing up, my dad's also a pharmacist, and I would go to the pharmacy to see him, and we would always have the little blood pressure cuff. And I would get so excited to push the buttons, to feel the little pressure coming around the cuff, tightening around my arm. And then the numbers would pop up. And of course, at the time, I had no idea what they mean. And as a pharmacist, I think one of the cool things is you actually start to understand what those numbers mean. And then you're able to sort of provide that education and guidance to other folks who are also trying to figure out how to navigate this landscape. And so thanks all again so much for joining, and let's go ahead and dive right into it. So, the first question, I think, if we're going to talk about blood pressure, is to get an idea of what is blood pressure? What exactly does that mean? And so like any volume, like any fluid that is occupying a volume of space, there is going to be pressure to that space. And the best sort of metaphor, the best sort of analogy that I can create for you is to imagine a hose. It's the springtime, it's the summertime. Some of you might be out watering your plants in your gardens. And so when you pull out that hose, when you unwind it and you finally get all the knots out, you turn the hose on and water comes out of the valve and it comes through the pipe and it comes out the other end. Now, if you decide that you want to increase the pressure that is coming out of that hose, you can increase the pressure that's coming out of the valve by turning the valve to open up the valve even more, so more water comes out. Or you could squeeze the top, you could block the top of that hose. And because now the same volume of water has to travel in a much smaller surface area, well, the pressure increases. And so think of the heart very similar to that pipe that you're using to water your lawns or your gardens. So the valve in this case is the heart. So the heart provides a certain amount of fluid, the blood, and that travels through the pipe, which is your arteries. Now, if I want, not that I would ever want to increase pressure, but if I want to increase pressure, I can turn the valve higher. In the instance of the pipe, in the hose example, in your heart, you don't have that opportunity, you don't have that ability. And so your pressure is essentially what is coming in and out of that valve, in and out of that pipe. And just like when you put your finger over the hose, that is going to constrict the volume that fluid has to travel, and it's going to increase the pressure. And so that's exactly what high blood pressure is. So when your heart is providing blood, the blood travels from your heart, it gets oxygenated by the lungs, and then it goes out to all of the different parts of the body in order for your body to receive that oxygen and receive the essential nutrients it needs to survive. Now, if there are blockages inside of your arteries, so this could be in the form of other diseases like cancers, this could be in the form of plaques built by poor diets or lack of exercise, like you see in cholesterol issues, those plaques can cause blockages, and that causes the blood pressure to be increased. And in the worst possible case scenario, very similar to if you had a pipe, if I block the pipe, well, the water is still flowing, and what happens is I get a rupture. Very similar in the heart, if I completely block one of the arteries, I could get a rupture, I get a heart attack, and unfortunately, people die because of this. And so this is why making sure that you manage your blood pressure and making sure that you're aware of all the different nuances and intricacies that are associated with it is super important. So when we talk about blood pressure or high blood pressure, it's actually a fairly common disease when we think about all of the diseases that exist that people have to take care of. And so high blood pressure ends up affecting about 1 in 3 people. And so that's 33% of the population that has blood pressure. And then if you look at even the amount of people that are at high risk, so these are people with maybe genetic components, have previous diseases like kidney disease, people who may have a family history of high blood pressure, all of those things means that if not 50%, but maybe more, people either have the disease or at risk of having high blood pressure. And so this is one of those things that's really important to keep track of. The other kind of concerning thing about blood pressure is it's largely asymptomatic. You know, most people won't even realize that they have high blood pressure unless they're screening their blood pressure, unless they're regularly checking it, or until they go to the doctor and the doctor tells them that they've got a diagnosis of blood pressure or of high blood pressure. And the scary thing about that is if you have a diagnosis and you're actively taking medications, a lot of people feel like, well, I don't feel like my blood pressure is too high today, so I can avoid taking my medications. Well, because blood pressure and high blood pressure is an asymptomatic disease, if you wait until you experience symptoms, too often those symptoms are things that are extremely dangerous and extremely severe, like kidney disease, heart disease, or a stroke. And so, you know, the best thing that we can do is we can maintain some of those basic healthy lifestyles that I know all of us have heard about. Great exercise, making sure you're going out and getting aerobic exercises, things that cause oxygenation to take place in the body. You could eat a healthy diet, things that will reduce those blockages and the buildup of those plaques in the vessels. And then the second, probably the most important thing that you can do outside of those lifestyle modifications is to screen, is to check your blood pressure. And so, you know, what I mean by, I'm going to use the terminology blood pressure screening or screening. And essentially what I mean by that is the act of actually getting one of those blood pressure monitors and regularly checking your blood pressure. And so that's sort of what I mean when I use that sort of terminology. So the first thing that I want you all to think of, and this is sort of a think on your own and reflect on it, how often are you all checking your blood pressures in your own homes? Maybe some of you have high blood pressure and that's what motivated you to come onto the webinar tonight. Maybe some of you have a family member that has high blood pressure. Maybe some of you are at high risk or concerned about it. So I want you to ask yourselves and sort of go through this. How often are you checking that blood pressure? Is it every day? Are you the kind of person that's diligent? It's part of their routine. They're coming in, they're checking their blood pressure. Are you doing it a few times a week? You know, whenever you remember. Are you doing it even later? Maybe only a few times a month. Whenever you go to the pharmacy to pick up your medications, you go ahead and try out the little blood pressure monitor that they might have. Or are you only checking it when you go to the primary care doctor? And that might be once a year at your physical. And so wherever you might be on this list, my goal is to try to get you one step higher. And so if you're only doing it when you're going to the primary care doctor, well, my goal is to maybe get you to do it maybe a few times a month or a few times a week. And if you're ideally every single day, if you're in one of these high risk categories. And so that's something that hopefully we're going to be able to inspire you by the end of the webinar here today. So in the high blood pressure, I want to start off maybe a little bit more detailed on sort of all the different components of it. And so we traditionally think of high blood pressure as just being high blood pressure. But if I break it down, there's actually 2 different types of blood pressure. There's primary high blood pressure. And primary high blood pressure is what the predominant population has. It's about 85% of people who have high blood pressure are diagnosed with primary high blood pressure. And essentially what that means is we don't know what causes this. Usually we know that there's a high correlation with certain risk factors. And so for people that maybe have obesity, for people that are consuming diets that are very high in sodium and high in salt, Smokers, people who have a family history, people who are sedentary, again, they're not getting a whole lot of activity, and people who have diabetes. Traditionally, we think of those folks as having primary high blood pressure. So while we can't point and say that this is a specific cause of it, we know that they're associated with a lot of these risk factors. And then the other 15% of people who have high blood pressure, well, we know that the cause of that high blood pressure is because of a specific factor. And those factors could be kidney disease. And so we know that because your kidneys are filtering out the blood, if you have an issue with your kidneys, it's going to affect how the blood is flowing in your body. And so that's going to have an impact on your blood pressure. We know adrenal diseases, again, that's something that is related to the kidneys. There's a lot of hormones and chemicals that your adrenal glands produce. And if there's issues in your adrenal gland system, that's going to cause an effect on your blood pressure. And then certain medications, ironically, can also cause an increase in your blood pressure. And so as we go through the webinar, we'll go ahead and touch on some of those medications and certain things that maybe you can avoid and be conscientious of, particularly with some of the congestion and allergies that might be going as we sort of leave the summer and go into the fall time seasons. So now that's like sort of the big level. So what's actually happening in high blood pressure when we have this? So in order to understand that, let's start at the very beginning part. Let's start at the valve. So if we go back to our pipe analogy, we know that a lot of the flow is happening because we're turning on the valve. Now your heart is that valve. It contracts. And so when it contracts, your heart is forcing all of the blood that is in the chambers to flow outside of the heart and go to the body. And so this could be going to the lungs to get oxygenated. This could be taking oxygenated blood and sending it to the rest of the body. But that action is called contraction. And that is when blood is coming out of the heart. The second activity that's taking place is dilation. So this is when the heart is resting and all of the blood is coming back into the heart to be sent back to the lungs on the next contraction or to go back out into the body. And so this is where you get that doot, 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 that sort of activity when people think of a traditional heartbeat, is because you've got contraction, dilation, contraction, dilation. And when we see here in the diagram, when that is happening, the blood is going all across the body and then it is coming back to the heart. And so it's a very circular system in this sort of thing. So we don't have a whole lot of options in terms of letting the blood go anywhere else. And so our next area of focus is going to be in the blood vessels. So we've gone through the valve, we've gone through that major, that valve that you turn that gets the blood going out of the heart. Now the second part is the pipe, in this case, the blood vessels. And so when we measure pressure, and when you look at the numbers, this is what a blood pressure monitor or a blood pressure screening is going to measure. It is measuring how much pressure is in those arteries at contraction and dilation. So that first number is called the systolic blood pressure. That's the number that's going to be on top. And what this number represents is when the heart is pumping, when it is going through contraction, the blood is leaving the heart and it is causing pressure to take place in the blood vessels. Now that pressure is called the systolic pressure, and that is the number that is going to be on top. That second number, so after contraction, the heart dilates, the blood is going back into the heart. So it's a little bit of a lower pressure because there's no force that's coming from the heart. And so that second number, there's still pressure that exists in the arteries, and that pressure is called the diastolic pressure. And that is the bottom number. And so when you go to the doctor's office or when you go and measure your blood pressure, you get two numbers. It's the systolic and the diastolic. And they're both measuring pressure in the blood vessels, but they're measuring them at different times. And so those numbers are what we use to categorize if a person has good blood pressure, if they have elevated, or if they should receive a diagnosis for a high blood pressure. So let's talk about what some of those numbers mean. Excuse me. So, I mean, first and foremost, let's talk about normal. Let's get to our target. What is our target blood pressure? And so we measure blood pressure in millimeters of mercury. And this is a sort of a fun tidbit. I don't know if there's any trivia folks here, but mercury was actually the first chemical or first item that we used to measure pressure back in the older days. Now we have a lot of different measures to use it, but this is why we still use millimeters of mercury when we're measuring blood pressure. So let's go back to sort of the first thing. So let's look at our normal blood pressure. So our normal range is going to be a systolic number of less than 120 and a diastolic number of less than 80. So if you see people that say, oh, I'm 117/75, that's a good blood pressure. That means that your top number is below 120 and your second number is below 80. So that checks out. That is a normal number. Now we're going to get to the elevated one. So our elevated category are going to be people that have blood pressures between the range of 120 to 129 on the systolic part, and less than 80 on the diastolic part. So if you've got a 125/75, you're elevated. Now, what does elevated actually mean? Well, elevated doesn't mean that you have high blood pressure yet. It's not a clear diagnosis of high blood pressure. It just means that you're above the normal range, and there are probably some activities that you can take to mitigate those risks. And so those could be things like lifestyle modifications and exercise, like we talked about earlier. It could be things like quitting smoking, like we talked about earlier. If you're on blood pressure medication, it could be a sign that maybe you're not taking your blood pressure medication the way you're intending to. And so those are all different measures that we use to see, once you're in that elevated bucket, you're above normal, but there are steps that we can take to sort of get you back into that normal category. Now we get into the confirmed diagnosis. So hypertension, which is called, it's the medical name for high blood pressure. Stage 1 is if you have a systolic number of 130 to 139, or, and this is the key part, or 80 to 89. So let's say that you had a blood pressure of 125/86. Well, your systolic number is 125, so that would put you maybe in the elevated category, but you've got a diastolic number of 86. And so that is a higher than 80 number. And so that automatically puts you in that hypertension stage 1 category. And that usually is a trigger that you need to go and talk to your primary care doctor. Make sure you get a couple of more readings, but this could be a sign that medication may be required to better bring in control and mitigate some of those dangers that we talked about. The second piece is hypertension stage 2. So again, the second stage of high blood pressure. And this is for people who have a number of 140 or higher, a systolic number, and then a diastolic number of 90 or higher. And so again, this is to just sort of frame the conversation. If you get to a hypertension stage 2, usually we start thinking about combination medications. We might think about increasing your doses or adding another medication as well. And so again, we want to be very aggressive when we get to hypertension stage 2, because we don't want to result in heart disease or a stroke or any of those terrible things we talked about. And then the last thing I'll sort of mention is this term called hypertensive crises. And this is usually when it's an emergency, because if it's not controlled, it can lead to some sort of organ damages, and it can cause a lot of problems almost immediately. And so if you see numbers higher than 180/120, this is really when you're going to want to go to the emergency department right away, because we need to use, IV medications to bring that pressure down instantaneously. So that's sort of the numbers. So those are how it's categorized by the American Heart Association. So if you don't have high blood pressure, your normal category is going to be less than 120 over less than 80. But because we know that when people get a diagnosis of high blood pressure, we have to change some of those targets. And so the American Heart Association has changed what normal looks like for people who have a diagnosis. And so for people who have high blood pressure, we give them a little bit more breathing room. And so our breathing room for those patients are less than 130 for a systolic number, and then less than 80 for the diastolic number. And so that's an important thing to note. And then the last thing I wanted to talk about on the slide was the pulse rate. I know that whenever we get a blood pressure reading, we get our diastolic, our systolic, our diastolic, and then there's our pulse rate. We're not going to talk a whole lot about it. It's just sort of how fast the heart is beating. But the normal number here is 60 to 80. And I know that there's a lot of wearable technologies and things like that that people can use to keep a better tracker of that as well. So now that we've gone through what the numbers mean, let's talk about how to actually use or how to actually take the blood pressure correctly. So there is a right way and there is a wrong way to do it. And if you're getting some really crazy numbers, make sure that you're taking it the right way. You could also get great numbers, but if you're taking that blood pressure the wrong way, those good numbers don't necessarily mean anything. and it could cause you to miss something that's important. So what I always say is the best time to take your blood pressure is right early in the morning, because at nighttime, our blood pressure naturally goes down. And so it's best to capitalize on that right in the morning. And so the first thing you're going to want to do is go to the bathroom. Is you wake up and you go to the bathroom. The reason is all of that pressure as fluid fills up in your bladder, that creates pressure in and of itself. And you don't want a blood pressure reading to be indicative of some other factors that are taking place in the body. So go to the bathroom, then come back, sit in a chair with your back straight and your feet flat on the floor. And the reason for this is if you're slouching, you don't want to pinch a blood vessel. You don't want anything to be necessarily uncomfortable. So sit straight, arms sort of out on your side, right at sort of heart level, and then keep both feet flat on the floor. The next thing is making sure you're using the right cuff. I can't tell you how many times when I was in practice, people would say, hey, my blood pressure is too high or too low or whatever. And I would ask them to bring their cuffs in, and they've got very, very small arms, but they're using a double XL cuff. You got to make sure you're using the right cuff that's specifically designed, because you don't want all of this air going into that reading. Support your arm. So again, you want to keep it about at heart level. You can use a pillow, you can use your other arm to sort of support it, and then relax. So once you've got all these steps going, take a few breaths, close your eyes. If you have to do just a few deep breaths in and out, do those things, because that's going to help you relax. That's going to bring that blood pressure reading down. Things to avoid. Caffeine. We all know caffeine accelerates our heart rate. We use it to wake ourselves up. It's a stimulant. Well, if we're stimulating ourselves, of course, we're going to see high blood pressure. Making sure that you're not exercising. If you've just run up a bunch of stairs, or if you've gone to go upstairs to the top floor of your house to get your blood pressure reader, again, make sure you're relaxing, because just that short burst of energy, that short burst of activity, that could lead to high blood pressure. Making sure you're in the right position. Don't use one of those finger monitors. I've seen a lot of people for the sake of convenience, they use one of those ones that just clip on your finger. It's not incredibly accurate. What we use for blood pressure readings is something called the brachial artery, and that is what goes down your arm. There really isn't a good substitute for that exists sort of at your fingers. And then the last thing is, don't talk while you're taking your blood pressure. Again, talking creates excitement. It can sort of take you away from some of that relaxing moments that you need to get an accurate reading. So things that I want to talk about real quick that can raise your blood pressure: cholesterol. Again, when you have a blockage in the artery, that's going to cause the same volume of blood to have to go through a smaller surface area. That's going to cause high blood pressure. Stress. If you're worried, work is bothering you, there's issues elsewhere in your life. Those things can correlate to higher blood pressure. And so people, I think it's used almost as like a metaphor in times like, oh, your blood pressure is going to go up, relax. They use it all the time in vernacular, in common language. And so, there is something to it. Kidney disease, we talked about, the kidneys filter the blood. And so if you have kidney disease, then the flow is going to be affected, which can cause high blood pressure. Smoking. If I can say one thing, and if anyone is watching and they smoke, the single greatest thing that you can do for your health is to make a plan. We understand it's difficult, we understand the challenges, but at least having a conversation and thinking about making a plan could cause so many benefits, not just in blood pressure, but other aspects of your life. But in blood pressure, this could have a significant benefit to you. And then the last piece is medications. And so some of the medications that I wanted to talk about, we talked about caffeine, which is technically a medication, but things like pseudoephedrine or Sudafed. I know with the fall coming around, people are worried about allergies. Well, Sudafed is a stimulant. It is a medication that is a stimulant, and that can cause your blood pressure to go up. And so making sure that if you have high blood pressure, you avoid those medications that can do that. So what can you do? What are some of those aspects that you have at your disposal? Well, weight loss. Studies have shown that for every pound you lose about 1 to 2 millimeters of mercury from your blood pressure reading. And so again, exercise, lifestyle management, healthy diets, all of those things are really good for you, not just because they make you feel good, they might affect other diseases, but for blood pressure in particular, we've seen a direct correlation, which is really advantageous to getting it under control. Healthy dieting, we talked about, smoking cessation, and then of course, monitoring. And this is sort of the real main point that we're trying to make here in this presentation, is to make sure you're monitoring it. If you're on blood pressure medication, make sure you're taking your medication the way you're supposed to, because that can go a long way as well. So these are the main points. Just sort of summarize. I know we covered a lot, and I want to hammer home what's the most important. So the first thing is monitor. Make sure you're regularly monitoring your blood pressure. I would love to say that at the end of this webinar, everybody's going to go home and monitor their blood pressure daily. But we know that it's challenging. We know that it can take some time to build good habits. So even if you're doing it a little bit more often than you were the day before, I think that goes a long way. Relax. We talked about how to take a blood pressure the right way. Make sure you've gone to the bathroom. Make sure your back is straight. Your feet are flat on the ground. Your arm is supported. You're relaxed. Make sure you're using the right cup size. Those are all things that are going to go a long way in making sure that you're getting an accurate reading. Know what your blood pressure target is. If you haven't received a diagnosis, it's 120, less than 120 over 80. If you have received it and you're currently going over medication, less than 130 over 80. And so those are your targets. Make sure you know them in the back of your mind so that whenever you get into that room or you're ever getting that reading, you know exactly what that target ought to be and you're able to communicate with your provider. And then here's some other things that you can do to better take care of your health. If you're taking your blood pressure, track it. It's not just, it's helpful for you, of course, but make sure you're sharing that information with your primary care doctor. The Know Your Meds app has a great tool that you can track and put in your blood pressure readings. And when you go to your primary care doctor, you can show them your readings and see if there's any adjustments that need to be made or if there's any areas of concern that you and your primary care doctor can together identify. If you see that you have high blood pressure, try to identify what some of those aspects in your life might be that could cause it. Are you more stressed because something is happening at work? Are you just not being able to exercise in the way that you wanted to? I know in the pandemic, a lot of us, myself included, maybe didn't have the best diets. And now as things are opening up, we're starting to get back into that. So take a look at all of those different aspects in your lifestyle, et cetera, that could be leading to some of those numbers that you're seeing in your blood pressure reading. And then make sure that you consider how these changes are going to affect your blood pressure in the long run. And so I know we went through a lot. I'm really excited. And I'm happy, Susan, now to turn it back over to you to see if there's any questions we've got.
Thank you, Nimit, for this very, very informative presentation. So I think that we're all ready now to use this information to start monitoring and tracking our own blood pressure. Now's the time where we can turn to our audience and answer your personal questions. So the first question is, what kind of medications can affect my blood pressure?
Yeah, so that's a great question. And so I know we talked about some of those medications in the webinar, but the main ones that I want you to think about are anything that can really cause your body, that's a stimulant, right? And so we think of simple things that we might not realize, like caffeine. It's a stimulant. It gets your body more energy, so that's going to raise your blood pressure. Some other things that we don't think about maybe are Sudafed, our over-the-counter cough medications, or cold medications. For some folks that have ADHD, a lot of those ADHD medications are also classified as stimulants. And so anything that we can see being used in that capacity, those are all things that could have effects on your blood pressure. Great question.
Wonderful. Now here's another very good question. Actually, the person said, great webinar. How does salt make my blood pressure go up?
Yeah, so this is fantastic, and so I want to sort of ask, whenever you have salts, right? What's the first thing that you do if you have a really salty item? You need water, right? You need water, and so think of your blood vessels as very similar. Wherever there's a large amount of salt, you're going to have a large amount of fluid that is going to have to come to accompany where that salt is going. And so as you take in more salt in your body, there's going to be a massive amount of fluid that follows that salt, and that's what causes the increase in blood pressure. And so there are actually numbers. I think if you're on the borderline, we talk about maybe getting down to below 2,300 milligrams. If you've got a diagnosis of high blood pressure, I think we try to get you down around below 1,500 to 1,800 milligrams of salts. And when you start looking at nutrition labels, And I know we have a nutritionist with Know Your Meds who does this way better than I can do it justice. And so I definitely encourage you to see her webinars as well. But when you look at nutrition labels, it's amazing the minute you start tracking a particular metric, how much you realize you're taking in. And so salts in the blood pressure space is so vital to make sure you're monitoring, because as you're taking in more salts, the fluid is going to accompany it right away.
Now, here's another question that is one that I thought of. What type of blood pressure monitor should I use?
Yeah, that's another great question. And I think it's so overwhelming sometimes when you're going down the aisles of your grocery store pharmacy or your local community pharmacy, and there's like 8 or 9 different types of blood pressure monitors, and so you don't really know which ones to get. I would say that any blood pressure monitor that is being sold is a good blood pressure monitor for you to use. Now, here are some of the differences, right? Some of them are well known and respected in the community. I know there's a lot of physicians that recommend products. Omron is one that I've heard a lot of people talk about and get used a lot. But your generic CVS brand, Walgreens brand, independent community pharmacy brand, blood pressure monitor is going to be just as effective. And so the only way you're going to be able to know is take your blood pressure, get a sense for it, get a feel for it. And if you start to think that you're taking your blood pressure every day and your numbers are super wonky, one day you've got great blood pressure, the next day it's super high, the next day it's very low, and you're not really changing anything in your exercise or diet, well, that's how you know that the blood pressure monitor is probably not a good monitor. Some of the more fancy ones, like the more expensive ones, I've seen blood pressure monitors go as high as $80, $90, if not $100. I think there's a tendency sometimes for people to think that if it's more expensive, it's better. That's not necessarily the case. The only thing that's really fancy about that is they might have these Bluetooth enabled devices that can send the data to your phone. They can create all these fancy charts. I think the simpler it is, the better it is, and the easier it is to use. And so any blood pressure monitor will be good enough to use.
Okay. Another person asked, what should I do if I miss a dose of my blood pressure medication?
Oof, that's a great question. So I know one of the things that we talked about to take control and to make sure you're on track of managing your high blood pressure is monitoring, so the screening part, and adherence if you already are on blood pressure medications. So it's incredibly important. Let me emphasize, it's incredibly important that you take your blood pressure medication every day. I remember I used to talk to some patients who said, well, I didn't have a whole lot of salt today, so I think I can avoid taking this medication. We said it earlier, first thing in the presentation, that high blood pressure is asymptomatic. And the only time we see symptoms of high blood pressure is when there's a problem. So make sure you're taking your medication. So that being said, if you miss a dose, depending on the regimen that you're on, if you're on once a day or twice a day, take it as soon as you remember to take your medication. There are going to be some specific aspects that I highly encourage you all to talk to your pharmacist about. But for the most part, you're going to want to take it as soon as you can remember, unless it's too close to that second dose, in which case don't want to double up, because these medications are particularly designed to operate within a certain level in the body. And so with that question, if you've got specific questions on your medications, depending on which ones you are, I'd highly encourage you all to talk to your own pharmacist or your own physician about that, just to make sure that we're giving you advice that's specific to your regimen and not something that's broad overall.
Again, thank you, Nimit. Most of all, I want to thank all the listeners here for joining the webinar. And if you didn't have your question answered, or you have remaining questions, or maybe you're listening to the recording after the fact, you still can get your questions answered. Email them to pharmacistconnect@knowyourmeds.com, and you will receive a confidential, personalized response. So lastly, I want to ask you all to please sign up for our upcoming live webinars on the app. And these are hosted twice a month, always on Thursdays at 8 p.m. Eastern Time. We look forward to seeing you again live on the Know Your Meds app. Goodbye for now.